You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, Food and Drug Administration Chief Eric Domingo. Dr. Domingo, welcome to The Source. Thank you for your time. I'm sorry we got cut because we were going to go on air. So first, Yusek, let's talk about these adverse events. Very important because what is coming out is about 76,000, more or less. There were 76,000 recorded adverse events after what, sir? 75 million vaccines used?
Yes, no, we've given 75 million shots. No, some patients, 33 million, have gotten either one or two shots, and then 12 million have only gotten one shot so far. So every time you get a vaccine, you can report an adverse event.
Whether it's on the first, sir, no, ibig nyo sabihin, or even on the second one, kasi nga karamihan sa mga vaccines natin, except for Janssen, ay dalawang dose. So when you look at that, 76,000, that's about, if I'm not mistaken, ang nabasa ko po, 0.01%. How does this compare, Dr. Domingo, sa ibang mga vaccines? Mababa ho ba itong, would it be considered low in terms of adverse events of a vaccine?
Yeah, it shows that the vaccines are safe, no, and that adverse events are actually quite low. During the clinical trials, they've seen as many as 10% of people get some form of adverse event, and the Philippines gets it at about 0.1%. And we're actually one of the top reporting countries in the whole world, no, when it comes to adverse events. Meaning Filipinos are really very, very excited and very participative when it comes to the surveillance system. And it shows that most people, meaning 99.9% of people, would get a vaccine and not feel anything, no? Or at least maybe something so mild that they won't even bother to report it.
I see. Okay. And then the usual, no, the most common would have been yung pagtaas ata ng BP prior to and maybe even during vaccination, and then the fever, headache, and pain. Any other adverse events that may be concerning?
So most common is yung really mild pain on the injection site. For 1 or 2 days, anybody who's gotten it will probably feel a little something. Yung BP, dahil syempre may mga ninenervyos talaga, no? Right before the vaccination, and then a few minutes after, medyo mataas yung mga BP nila. And ang binabantayan talaga natin would be allergies, no? Kasi ito yung medyo urgent situation na if you get a severe allergy to it, then you need to be treated right away.
I see. Okay. And then I remember also reading, Dr. Domingo, na the vaccines you said could be commercially available by, if I'm not mistaken, first quarter of 2022?
Well, initially, most of the companies said that they would apply for a full approval, no, towards the end of the year. But unfortunately, until now, we haven't gotten a single application yet. But several companies are asking already about the process and what the requirements are. So if they do apply for a full registration and a marketing authorization within the month of December, it's possible that by the first quarter of next year, we'll have vaccines that would be commercially available.
But just also for our consumption, meron na ho bang vaccine worldwide that is commercially available? Yung meron na pong, how do you call it, a product of certification?
Yes, product certification or marketing authorization. There's only one, no, Pfizer, and it's only available in the US. So sa US FDA pa lang sila nag-apply ng full registration. That's also because that's where it was developed. Usually they apply the home country first, and then once they get that and they're ready, then they apply to other countries, including the Philippines. But the other manufacturers, the other vaccine developers have not yet gotten a full registration yet.
All right. We just need to take a very short break. The Source will be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, Food and Drug Administration Chief Eric Domingo. Dr. Domingo, what about vaccination for ages 5 to 11? From last I read, this is already being done in the United States, in Israel, and very recently, I think kasama na rin po ang Canada?
Yes, no, and they're using Pfizer. No, this is the vaccine which actually we allow right now for 12 to 17-year-olds here in the country. And the company told us that they will apply soon, no, to include 5 to 11 here. I think they're just completing some documents because it's a slightly different formulation, no, this slightly different preparation from the one used in adults, and we have to take a look at the new formulation of the vaccine. So I'm confident that within the month of December that they will apply an extension, no, for the EUA to include children 5 to 11. So we might be expecting that towards the end of the year.
But what do you mean by a slightly different formula? So in context, yung ginagamit po nating Pfizer ngayon for the adults and those 12 to 17, pareho lang po yun. But are you saying that the one from the 5 to 11 will have to be modified one way or another? Ganun ho ba yun?
I think it's a lower dose, first of all. No? So kasi maliliit na bata na yung 5 to 11. And kasi yung preparation, when I say preparation, it means the way it is bottled, how many doses per vial, and whether it's in liquid form or in powder form. So yun lang yung mga pagkakaiba. It's the same vaccine, no? It's the same mRNA, but might come in a different form and in a different dosage for smaller children.
But does that mean that the available Pfizer vaccines are the same ones that can be used for the 5 to 11?
Possibly not, no? Kasi very particular ang EUA thinking, no? Every time we give an EUA to a product, it's exactly the form that it was used in the clinical trials. Even the same manufacturing line and the same certification that manufacturing line will consistently bring out and produce good quality vaccine of that identical vaccine. So it's possible na yung ginagamit natin sa adults ngayon, hindi yan yung gagamitin for children.
So even if aprubahan ninyo ng FDA, sir, kailangan pang hintayin a different batch of Pfizer vaccines for the 5 to 11. Am I understanding it correctly?
That's also my that's what I foresee. No? Although I haven't seen the application, no? But if it is going to be a different preparation, then it will be another batch that's going to be used for children and not the existing ones.
Okay. Molnupiravir. Meron pong naging statement si Dr. Salvana regarding this because we already have this in the country. I think the Office of the Vice President has this and the City of Manila as well. Ang sabi po niya kasi is be careful kasi meron pong mutagenic potential. I don't really know what that means. Dr. Domingo, maybe you can explain that to us and tell us more about molnupiravir.
Yeah, so molnupiravir is an antiviral drug. No? This is developed by a company, yung MSD, and they've given licenses to several manufacturers to manufacture it to get it available cheaper. No? It has gotten an emergency use authorization in the US and in the UK. Dito sa atin nag-a-apply pa siya ng EUA. So technically, it's an investigational drug which is available in the Philippines under compassionate special permit, meaning the doctor is asking for it for the patient, but the FDA has not completed any evaluation on the product yet. Pero since bago to mga products na to, of course, wala pa tayong masyadong alam dun sa long-term effects niya. No? We know that it does prevent parang 50%, no, of people going to severe COVID if you get mild COVID and if it's given early enough. But of course, the short-term safety is okay. Pero hindi nga natin alam kung meron siya, for example, magiging effect sa buntis or sa may planong magkaanak. So even if it is used now, that is one of the primary considerations. Hindi siya pwedeng ibigay sa buntis, hindi siya pwedeng ibigay dun sa nagpaplanong magkaanak soon. And if you're taking it, you make sure you use contraception na you don't get pregnant. Just because we do not yet know how safe it is for this group of patients. So, under CSP, we really have to be very, very careful with the drugs, even under emergency use authorization. Kasi ang masasabi lang naman natin, tinignan siya ng experts kung may EUA and that the benefit of using it outweighs the risk. but we have not yet established on the long-term possible risks of using these drugs.
Very quickly, Dr. Domingo, South African scientists detected a new COVID variant, pero apparently this is still in small numbers. You have any information on this?
Well, this is still being monitored now by the WHO. So usually, once a new variant is detected, the WHO will watch if it's something that's easily transmissible, if it causes more severe illness, if it has what you call parang meron siyang breakthrough over the existing vaccines. And once we get more detail, then it's either decided that it's not an important one, or the WHO will make din naman a declaration if it's a variant of concern that we should be watching. But so far, right now, there's not much information on the new variants.
Okay, FDA Chief Eric Domingo, sir, thank you so much for your time.
Maraming salamat din.
And thank you for joining us here on the Soar Sign Pinky Web. You're watching CNN Philippines.